Welcome to Module 3, Re-engagement in Meaningful Activities. In this module, we're going to focus on getting back to doing the activities that matter to you. So you may be wondering, what are the different levels of occupations? We've spoken about them in previous modules, but occupations are the daily activities that you engage in, both as individuals and with others. They give you a sense of purpose and identity. Now, these occupations can be broken down into 9 different categories. These include activities of daily living, instrumental activities of daily living, health management, rest and sleep, education, work, play, leisure, and social participation. These can include activities such as showering, gardening, cooking, volunteering, going to church, and playing with grandchildren. In occupational therapy, we have this concept of occupational balance. Occupational balance is the concept of having the right amount and variability of all of those different occupations and meaningful activities, and can be simplified into leisure, productivity, self-care, or maybe work, if that is still a part of your life, if you're not retired. This balance can often be disrupted by breast cancer, its diagnosis, and treatments. You may be experiencing upper extremity and physical impairments as well, such as reduced range of motion, pain, lymphedema, as well as cancer-related fatigue and the mental health challenges that we have discussed so far. There are strategies that we can use to improve overall occupational engagement and balance, and these include energy conservation techniques, fatigue management, scheduling, and understanding when it is okay to ask for help. Some common signs of occupational imbalance include increased irritability, feelings of being overwhelmed, as well as physical symptoms like headaches, digestive issues, or difficulty concentrating, or feeling like you have a never-ending to-do list. So it's important to reflect and see what a good, balanced lifestyle looks like for you. So first, I want to discuss cancer-related fatigue, or CRF. It is described by the American Cancer Society as a physical, emotional, and mental feeling of tiredness or exhaustion. And this can occur either as a result of the cancer itself, its treatments, or both. Unlike everyday tiredness, this type of fatigue is unique and it cannot be relieved by rest or sleep alone. It is extremely real and valid, and if you have experienced this, know that it is not ordinary tiredness. So if you have people just saying that you should sleep more, just you can let them know that that's not how this works. However, there is good news. Cancer-related fatigue can improve over time, and there are certain strategies that you can use to help manage these symptoms to help you gradually reconnect with the activities that are important to you. There are some strategies that you can use to help combat cancer-related fatigue. So first, physical activity. Try to aim for 15 to 30 minutes of physical activity a day. Some of the different exercises we talked about in the last module are a great idea. Or just participating in something low stress, like chair yoga, a short stretching, anything like that, that can help you get up and get the blood flowing again. Additionally, smart napping. This includes keeping your naps throughout the day to 20 to 30 minutes as best as you can, and making sure you're not napping after 3 p.m., as this can interrupt your sleep cycle. Lowering stress levels by participating in some of those mindfulness-based practices such as deep breathing and body scans, meditation, mindfulness-based art practice, things like that to help reduce those stress levels. Furthermore, eating a balanced diet and staying hydrated and trying your best to get 7 to 8 hours of sleep each night. While these aren't a surefire way and it's not going to heal your cancer-related fatigue, these strategies can help reduce the overall symptoms that you may be experiencing. Now we're going to discuss the spoon theory. The spoon theory is a way to help explain to friends or family and to yourself how to recognize when you need to take a break. Developed by Christine Meserando, the spoon theory is a metaphor that helps illustrate how people with limited physical or mental energy can handle their daily responsibilities. So think of a spoon as a unit of energy. Imagine you start each day with 12 spoons. Each daily activity will require a different number of spoons. For example, a 1 spoon activity may be getting out of bed, getting dressed, taking your daily medication. 2 spoon activity may be taking a shower, brushing your teeth and your hair, calling a friend. A 3 spoon activity may be meeting with a friend, making and eating a light meal, or light housework. A 3 spoon activity may include meeting with a friend, making/eating a meal, or light housework. And a 4 spoon or a 5 spoon even activity can include going to work, grocery shopping, exercise, or going to a doctor's appointment. This is a very individualized theory. Every person is going to have a different idea of what and how many spoons an activity or daily responsibility is going to cost. Furthermore, I want to note that there may be days that you don't wake up with 12 spoons. You may wake up with 5, 10, even less than that. And it is important to recognize when you wake up, have a mental check of how much energy you feel like you can spend throughout that day. This gives you a good idea of when you need to stop throughout the day and take a break. It also helps you to prioritize daily activities and commitments that you know you need to stick to. Furthermore, it can help you communicate those fatigue and energy level boundaries to friends and family. Also, encouraging self compassion and grace and mindful scheduling. By thinking about this theory when you wake up in the morning, it can help you look at your schedule and see what you have going on that day and make sure that you don't overschedule yourself or spend too many spoons in the morning before you have a big event or a dinner that you're really excited to go to. You want to make sure that you're resting and keeping enough energy for those activities that are meaningful to you. Now, we're going to talk about the 4 Ps of energy conservation. The 4 Ps of energy conservation are an evidence-based approach to protecting mental and physical energy to engage in daily occupations. First is plan. You want to schedule your most demanding activities for times of the day where your energy levels are naturally at their peak. This may be the beginning of the day, after an afternoon nap, for example. Furthermore, try to break up large, demanding tasks into smaller steps and spread them out throughout the day or maybe even the week. This can help you to still complete those tasks and those commitments while not overexerting your energy or yourself. And then if you click the link for the workbook, you will be able to click a daily planner template, which you can see here. By using a daily planner, this transforms your mindset from a reactive to a productive one. And can save your mental energy for essential tasks, significantly reduce stress and anxiety, and prevent overcommitting. The next P is prioritize. You want to identify the tasks that absolutely need to be done and focus your energy on those essential tasks. You want to identify less critical or physically demanding tasks that can be delegated to friends, family, or support systems in times of need as well. The next P is pace. You want to maintain a steady, moderate speed when completing tasks. Furthermore, by taking planned rest breaks before you become exhausted can also help you to conserve some of that energy rather than using it all up in one moment. Additionally, avoid the urge to rush or push through tasks because that's when you can find that you get overly exhausted and you may have just used up your energy for the rest of the day when you may be able to just take a rest break, 5 to 10 minutes, maybe 15, get back to that task and still have enough energy to complete different activities throughout the day as well. Lastly, position. By using strategies such as sitting down while preparing meals or getting dressed, utilizing good posture to ensure adequate breath, and the use of assistive devices can also increase your ability to participate in multiple daily activities and conserve that energy. Next, we're going to talk about sleep hygiene. Sleep hygiene refers to the behavioral and environmental habits that promote high quality sleep. Consistent, high quality rest is the foundation for energy management. The main things to think about with sleep hygiene include consistent sleep schedule by sticking to a routine, trying to go to bed and waking up at the same time every day, even on weekends. Furthermore, with that sleep routine, a simple method for promoting healthy sleep habits is the 10-3-2-1-0 rule. This rule involves no caffeine 10 hours before bed, no alcohol or large meals 3 hours before bed, finish working and any significant cognitive tasks 2 hours before bed, and turning off all screens 1 hour before bed. Lastly, you're going to try not to hit that snooze button in the morning. In addition, introducing a relaxation routine before bedtime, such as a warm bath, light reading, meditation, or gentle stretching, can also just help your body get into that mindset of sleep. By optimizing your environment, such as reserving your bed for sleep, keeping your bedroom slightly dark, cool, and quiet, and also keeping phones, TVs, and work materials in another room can help your body recognize that when you lay down for bed, it's time for sleep. Healthy daily habits that you can implement to support and improve sleep hygiene include spending time in natural sunlight during the day. This will support your natural circadian rhythm by stimulating your body's internal clock to start producing the natural melatonin. Additionally, getting regular physical activity, but you want to make sure that you avoid strenuous exercise right before bedtime, as well as eating your larger meals 3 to 4 hours before lying down. Next, we're going to talk about assistive devices for daily activities. Assistive devices or assistive technology can improve occupational engagement by increasing independence and bridging the gap between your physical abilities and the demands of your daily tasks. These first two devices essentially act as an extension of your arm. These include the long-handled sponge and reachers and grabbers. The long-handled sponge can be useful in the shower as it can help you to bathe your back and lower extremities without having to strain your shoulder or bend over in the shower. Similarly, a grabber or a reacher can act as an extension of your arm as well, assisting in retrieving items from the floor or the high shelves without extensive strain. Next, we have a universal turning handle or an all-purpose opener. If you experience joint stiffness or pain in your hands, these tools can assist in opening jars or cans to help with meal preparation. Next, we have a shower chair / shower bench. These are tools that can help eliminate the need to stand during the shower. This is going to help naturally reduce the risk of falls as well as conserve your energy in the shower. Additionally, dressing aids such as button hooks, sock aids, or dressing sticks can help promote independent dressing. Lastly, positioning pillows are extremely important, particularly after surgery, to stabilize surgical sites, minimize fluid buildup, and provide support to improve quality sleep. Now I'm going to introduce to you some simple daily stretches that you can add into your daily morning routine or nightly routine if you're experiencing reduced range of motion in your upper extremity, trunk, or chest. This can help significantly improve that. So before we dive in, I just want to quickly note that any of these stretches should not feel painful whatsoever. You should experience a light, comfortable pull. Consult with your healthcare team before beginning any new exercise or stretching routine, especially if you've recently had surgery. Your first stretch are arm openers. So you're going to lie on your side, or you can also do this by standing against a wall. Lie on your side with your knees bent and your arms straight out in front of you with your hands together. You're going to slowly lift the top of your arm and open it across your body, rotating your upper back and chest and looking at the other arm. Then you'll return to the starting position and repeat. You're going to do this 5 to 10 times. Next, you want to grab a wand, a broom, a cane, anything that you can hold on to with your hands. You want to lie on your back with your knees bent, holding that wand with both hands. You're going to keep your elbows straight. Slowly lift that wand overhead until you feel that gentle pull. Hold for 30 seconds, 15 seconds, and then return to your starting position. You want to repeat that 3 to 5 times. And this is even something that you can just do while lying in bed as well. Wall slides are another great stretch that you can do. Start by facing the wall and place your hand on the wall. You can use a towel, a rolled up t-shirt, a rag, anything that's going to help you glide up that wall. While standing in front of the wall, slowly lift your hand and slide up the wall and then come back down. You want to repeat this exercise about 5 to 10 times. Next, by utilizing a towel, you're going to stand with one hand at the top and one hand at the bottom. And you're going to use your hand at the bottom to gently stretch your arm at the top. You're going to hold that stretch for 5 to 10 seconds, return to the beginning position, and repeat 5 times. You can then switch sides and repeat. A tip for this stretch is you want to stand tall and keep your shoulders relaxed. Move slowly and only stretch to a comfortable range. Next, you have a doorway stretch. You want to stand in any doorway within your home with your forearms resting on each side of the door frame. And this can be at any comfortable height of the door frame. You want to step 1 foot forward and gently lean, leading with your chest, not just with your neck or your head, until you feel a gentle stretch across your chest and in the front of your shoulders. You want to hold that stretch for 15 seconds and then return to the starting position. You can repeat this one 3 to 5 times. And another tip for this stretch is to nominate a door in your house to become your stretching door. Every time you walk through that door or you pass by it, let that be a reminder to take a break and practice this door stretch. Lastly, we have shoulder blade squeezes. You want to stand or sit with good posture with your arms bent at your sides. Gently squeeze your shoulder blades like you're trying to pinch a pencil in between your shoulder blades. Hold that for a few seconds, relax, and repeat. You want to try your best to keep your shoulders down. You want to have them up like this while you're trying to do that. You want to keep them relaxed away from your ears. Slowly pull them back, hold, and release. Repeat this one for about 5 to 10 times. So now that we've come to the end of Module 3, I want you to reflect on the strategies we have discussed today surrounding re-engaging in meaningful occupations. Take the spoon theory we discussed, for example. What activities are worth spending your spoons on? Are there activities that you can modify, delegate, or simplify to make room for something that's meaningful to you? Take a moment to reflect and write down 3 meaningful activities that you want to engage in over the next month. Maybe it's something you haven't been able to engage in, either due to fatigue, pain, stress, anything like that. Or maybe it's something that you have been engaging in, but not as often as you would like. Anything that you feel that brings life and meaning into your daily life. In our next module, we'll talk about different strategies that you can use to improve long-term wellness over time.